This is News Channel 5 at 6.
Good evening. Another sharp spike in COVID-19 numbers tonight as the curve keeps climbing in Tennessee.
You see here more than 2,400 new cases reported just in the last 24 hours. 19 counties now have at least 500 cases confirmed. 685 people have died in Tennessee and more than 3,000 people have been hospitalized. Experts say it's a dangerous combination as the case count continues to rise in Tennessee. Availability in intensive care units is becoming harder to find. News Channel 5's Chris Davis spoke with a Tennessee doctor who's sounding the alarm.
And I think this is very concerning.
In an emergency, you expect to be taken care of. Dr. Aaron Millstone is worried that's a promise they can't keep.
We literally had 480 beds right before the 4th of July. And now we're down to 393 ICU beds.
Currently, there are less than 400 ICU beds available across the entire state. This comes as the number of COVID-19 patients hospitalized has more than doubled in a month.
And you have to remember the population of the state of Tennessee approaches 7 million people. So now that our state is averaging 40 to 50 new COVID-19 patients hospitalized a day, these numbers are going to continue to whittle away at our capacity.
It's a ripple effect that could impact supplies, testing, even patients that don't have the coronavirus.
So if you've had a heart attack or a stroke, or if you're a young person in a car accident, you may not be able to go to the hospital you want to go to.
Dr. Millstone admits shutting down the economy again is just not a good option. So he does suggest everyone wear a mask and the state make it mandatory.
In addition to a statewide mask order, Millstone tells me he wants to see the state actually enforce the Tennessee Pledge for businesses.
Then you have to have a way to report that to the state. So if your employer is endangering the public or their workers, we've got to have a way to hold them accountable.
He's worried if the situation doesn't change, things will get worse, and that's a promise he can keep.
The time to act in the crisis is now. If we let this get out of hand, which it appears we are, then we are really going to pay for it when the flu season starts in 90 days, if not sooner.
Chris Davis, News Channel 5.
Thank you, Chris.